Hi, everybody. I'm back after a long and much needed break. I wanted to talk to you today about an issue that's come up in a couple of recent supervisions, and that's the issue of not only what to do, but how to understand a resumption of symptoms, let's say in mid-treatment or even just after the first couple sessions. So this all depends, of course, on the particular case, how you understand the conflicts and factors responsible for the symptoms, and also the context. So when in any session, when the issue of particular symptoms come up, panic, impotence, depression, doesn't really matter, we are going to search in some detail to discover, first of all, what the precipitating incident was. This is very important. So what's the situation, the conflict that is triggering the conflict and giving rise to symptoms? We have to discover that trigger, that context. And then we begin to do the triangle of conflict work to look at the feelings that are getting evoked in that symptom generating situation, then monitoring and evaluating the level of anxiety, and looking at the defenses against those feelings. So are the symptoms the result of repressing those feelings? Or in other cases, could it be a backlash really generated by unprocessed guilt that goes into self-punishment? So this is the factor I've seen in a couple of recent cases in which the therapist is going for anger, typically in the current, although it could be in the transference as well. But they're really only getting to the anger. So this is either a misunderstanding and they don't realize the issue is to get to all of the complex mixed feelings toward others so they can be tolerated and integrated, or whether they simply ran out of time. Right, and they had just gotten to that first level of reactive anger. But if you do that, and then the patient comes back with neck pain, back pain, depression, that certainly suggests that there's been a backlash, that there is unprocessed guilt about the anger that's going into self-punishment. So this is very, very important, and that's good data because there actually are cases in which the patient is just anxious about their anger and they suppress it such that they become fatigued, depressed, might have pain, and that when they can experience that anger, it goes quite directly into a constructive avenue of self-assertion, and there's no backlash whatsoever. There's not a heavy load of guilt. But when you see that backlash, it's a pretty good indication that there is guilt about the rage that hasn't been faced and experienced directly. It's going into self-punishment. And that is an exceptionally important dynamic to drive home. So this is that other thing. It's not just about getting to feelings, right, but the memories and dreams and associations associated with those so that you can have a deep understanding of them. And then, as Davinlu said, drive home the insights over and over again to that link between defenses against feelings and the particular symptom. So let's say you've done all that and it's going really well. And now it's time to terminate. And suddenly the person is having a resumption of symptoms. right? So this is where context is so important, and you'd have to wonder if the patient is somehow holding on to or going back to those problems in order to hold on to the therapist. So there are many factors to consider here, but one thing I want to say is that it's not, don't panic, right? It's not necessarily a problem or a mistake, right? That symptoms are returning. It means whatever the conflicts are responsible for those symptoms hasn't been resolved. And it often takes multiple times of discovering, right, triggers and feelings and so on for that conflict to actually be worked through. Another case I'm thinking of is one of a man with very, very serious major depression recurrent, and he had had an exceptionally positive response to our first 3 sessions. And in addition to examining the specific mechanism, that depressive mechanism, we were really looking at his character, a very passive, compliant, subservient character, which really set him up for depression. And so we were dealing with that a great deal. And he really started to turn on those and consequently started to speak up and assert himself. And as you can imagine, in certain systems where that's been in place for decades, there's pushback, major pushback from the people in his close circle who had a lot to gain by keeping him in that one down, passive, subservient position. And so his resumption of symptoms was a direct response to that. And it was not only about his feelings toward the people who were trying to shove him back, into that position, but there are real interpersonal dynamics there and an actual threat that if he did not return to that subservient position, that he could lose the most important relationship in his life. So these are extremely important factors to keep in mind. And I hope this is helpful. I'd love to hear from you about your experiences with symptoms coming back, right, at any point during the treatment. And again, just remember that development is almost never smooth or linear. If you even think about physical development in childhood, it goes like this. There are growth spurts and then plateaus, and then sometimes there's a regression, right? So a child who's been, potty trained after a new baby arrives sort of regresses. And so, again, it's not a problem. It's something to be understood and worked through. So I hope this is helpful to you, and I look forward to hearing from you. Bye-bye.